I'm Jessica. This is my pediatric head-to-toe assessment. My patient today is Olivia. This is my 3-year-old daughter. So before I enter the room, I've already gathered all my supplies to take in with me, and I've washed my hands. So I'm going to knock on the door, enter. I'm going to introduce myself. Hi, I'm Jessica. I'm here to do your head-to-toe assessment. Is that okay? And I'm going to get verbal consent from the mother also. And I'm going to verify the patient's name and date of birth. Can you tell me your name? Olivia. How old are you? 3. And her wristband does match her date of birth and her name. Mother also verified. I'm the mother. Okay, so what I'm going to start with next is I'm just going to go ahead and look at her. She's 3. She's got good hygiene. Her hair is nice. There is no signs of alopecia in her hair. It's well groomed. Her clothes look good. Her skin is warm and dry to touch, and the color is good to her ethnicity. There's no signs of vitiligo, no bruising, no scratches. Looks good. Her head is normal cephalic. Her eyes are symmetric. Her ears are symmetric. Her nose is even in midline. There's no drooping to her mouth. Her ears are firm. The cartilage is good. I'm going to just look right now into her eyes and check her pupillary reflex. Keep your eyes open, baby. Okay, and look at mom. Okay, and her eyes, her pupils are equal and reactive. And now look at me. I want you to look at me, and then when I tell you to, I want you to look at the window, okay? Look at me now, though. Okay, look at the window. And they are round, equal, and reactive to light and accommodation. Okay, next I'm going to look at her nose and look for patency. There's no nodules, nothing in her nose that seems to be out of whack. There's no deviation to her septum. There's a little bit of boogers, but not a lot. Can you open your mouth? Okay, her teeth are all intact. There is none missing. Her oral mucosa is moist and pink. Her lips look good. I'm gonna look at your eyes one more time. Her conjunctiva in her eyes is pink and moist. Looks good. It's pink.
Pink my
Favorite. Okay. I'm gonna look at her ears. There is just a little bit of cerumen, but not a lot. They look patent. Looks good overall. Okay, now I'm just gonna feel your neck, okay? Her lymph nodes are palpable, which that is normal in children. Good. Your toes are itchy. Okay, next we're gonna go ahead and move on. I'm gonna listen to her heart, okay? And her heart rate is very strong and normal. There's no signs of bruise heard. I'm next going to go ahead and just listen to her abdomen while I'm here. And her bowel sounds are hyperactive in all 4 quadrants. When was the last time you had a poop? Yesterday? And her bowels are moving. Okay, now I'm just going to listen to her lungs. Take a deep breath in. And again, breathe in really hard. Okay, let it out. Good girl. Again. her lungs are clear bilaterally. And then let me just listen right over here.
I like that.
Love that.
It's so pink.
Which is pretty funny. Okay, and she has symmetric dermitis on both sides. Next, I'm going to, can you lay down for me? Should she lay the other way?
Just one.
Okay. Okay, I'm just gonna feel on your tummy, okay? Can you tell me if it hurts? Tickles. Okay. Her abdomen is soft and non-tender, with light palpations. Okay. And lift your shirt up. Her umbilicus is midline, so it looks good. Okay. While you're here, let's see. Her legs are good. Can you squeeze my fingers for me? Squeeze really, really hard. Okay, her hand grips are equal in strength bilateral. And can you push on my hands? Push really hard. Okay. Now push against them again. Push against my hand. Or push back on it. There you go. And her dorsal and pedal reflexes are good. Sorry, I can't remember those. Or her pedal pushes are good. Sorry. What are we gonna do next? Next, I'm gonna check all her pulses. So, it's her radial pulse. And those are equal in strength, +2. Brachial. Those are both equal in strength, +2. Her carotid. And you don't want to push on these both at the same time because it can occlude them. Next, we would assess the femoral pulses, which is in the groin, the popliteal behind the knee, the posterior tibial, the back of the foot, and then the dorsalis pedis on top of the foot, and they are all equal in strength and very strong. Okay. We did do her vision outside of the room with the Snellen chart, and it was with the, not the letters, but the objects, and she got them all right, so her vision is good with normal acuity for her age, and her hearing test is good. On adults, we would do the tuning fork and the Rhine test. Next, I'm going to go ahead and check her reflexes. Okay, sit still for me. Your picture. We're going to say that's good. Oh, sorry. And we're going to say her reflexes are good on both knees. I think that's it for now. If you have any questions or need me to redo it or something, just let me know. Thank you.